If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
What's up, man?
I'm good. It's good to talk. We're international. We've gone international now.
Yeah,
Both in our home offices, or I don't know where you are actually. You're not in home.
No, I'm in a co-working spot, but I am in Mexico City at the moment. I'll be back in Nashville next week. We've got Nashville healthcare sessions happening next Monday and Tuesday, and we're doing a panel with the folks at Barclays and Welsh Carson, and then we'll be recording in our Nashville office next Thursday. Yeah. Everything is rainy as per usual here in Mexico City.
Same in Nashville, really.
Yeah, but lovely nonetheless. Busy week in the news for sure. Tylenol seems to be all anybody can manage to talk about. Jimmy Kimmel and Tylenol. It's kind of like
Jimmy Kimmel's back, and it's probably his most popular show ever. Was his comeback show? Yeah,
of course. Well, now he it's amazing, all these accidental icons. You know what I mean? That are becoming, right? I mean, it's like, yes, they stood for things. Yes, but in this moment, each side politically is really like rallying around, different figures. And it's just, I don't know. I feel like it's something we read about in history books, and here we are living it. It's kind of a weird thing. All right. Well, we got a long show, a lot of stories to run through. And why don't we just go ahead and start and dig in? Starting with Trump. Trump rejects a meeting with the Democrats as the shutdown approaches. As we were preparing for the show, I think we're starting to just see that there are many stories. I don't know, this is episode 160, and some of these things just kind of cyclically keep coming up. And so I think they are less kind of critical for us to focus on. But also it's important to sort of be aware and also think about what might be different, right? This time around from previous near government shutdown. So, what do you see as potentially different this time?
There's two differences here that I think are worth talking about on our show. So the first is the Democrats are, I think, I use the word demanding, or they're at least suggesting that they would vote to keep the government open if the Republicans extended the subsidies for the Obamacare exchanges. And so it's a healthcare request that they're demanding. I don't know how likely that is. Both Trump and the leaders on the Republican Party at Congress have said no. But that's the first thing. And then the second thing is, for whatever reason, I don't know, I mean, you and I have to work, but they took this week off in Congress. So they're on recess. And so they're going to come back on Monday. There's no clarity on how they will extend payments for the government. And they have 2 days to do so. And it's my sense that Trump is sort of just not that concerned about it and going to view it as a way to, cut costs, which is not the best way to cut costs. Obviously, if there are costs to be cut, which I think probably we should cut costs, it'd be much better for the two sides to be adults and do their job and figure out what, like any company would do, figure out where you need to cut costs, as opposed to this just kind of run out of money. And then it's going to give the Office of Management and Budget, OMB, pretty wide discretion to make changes, which is not going to be, I don't think it's going to be positive, but we'll see.
Yeah, I mean, there have been people who've been calling for the Democrats to use this as a moment to, they don't have a ton of power, but this is kind of one of those moments where they do have some power. And
they do have some leverage. They can't pass it without the Democrats. So.
Yeah. And so, there have been people who have been calling for the Democrats to use this moment to get as much as you can, and also, really be willing to dig your heels in and go over the cliff. Like, people have been saying, like, what the hell do you have to lose? So to me, that actually feels like a third difference I would focus on, because I don't recall hearing that from Democrats in the past ever, right? You know what I mean? They've always sort of been like, we've got to keep the government running, right? Even when they were not in control of House and Senate. And this time, it does seem that there are some calls for them to behave in a more activist way. So we'll see how it plays out. I agree. So far, we've never seen it actually go to anything longer than a short sequester.
Day or two, right? Yeah.
Yeah. So I don't know. It's not anything I'm paying a ton of attention to. Okay, U.S. Chamber of Commerce Small Business Index for Q3 of 2025. You pointed this out because I guess you found that it was an all-time high, meaning small businesses are feeling that the economy is better than ever right now. And I just kind of questioned. I just kind of questioned that, right? So tell me a little bit about.
So the U.S. Chamber of Commerce polls small business owners. I'm not exactly sure how you qualify for that, but they've been doing it for a long time. Maybe go down and show the viewers, people watching on YouTube, that there's a chart in here. Small business owners are more optimistic than they ever have been before, which is really surprising to me. I would not. That's not how I feel. Now, it's a little bit of exaggeration. I mean, it is an all-time high, but it's, as you can see from the chart, it doesn't vary that much. I mean, the way they score the index seems to be pretty, bounded between 75 and 60, and we're at 72 this quarter as an all-time high. So, I mean, it was noteworthy to me because it's so different from how I am feeling or what I'm hearing from small business owners. Now, I don't talk to that many, but certainly our portfolio. So I don't know. It's just interesting. I think it's valuable to pay attention to these outliers. But, maybe they see something we don't see, or maybe they're late to the party. I don't know.
Yeah, I want to be careful because I certainly don't want to come off like I'm having a particular partisan bent to my thoughts on this, but I feel like my sense of confidence in these kinds of data points is really much lower than I think it's ever been in the time we've been doing this podcast.
Yeah.
Whether it's the revisions or the political, hirings or hirings.
Clearly was not right. Yeah, it was not good.
Yeah. And I recognize this is not a .gov thing. It's MetLife. It's got a corporate sponsor attached to it. But even when I'm looking at the highlights and the talking points, they feel kind of partisan, honestly. Heavy focus on the negative stuff is like regulation. Maybe they didn't have enough time to respond to some of the most recent things that have come out. But and I'm talking about like the H-1B visa and things like that. But I could see you saying, hey, sort of everything being even. But to me, I'm just like, with labor costs and artificial intelligence and I'm like, okay, if you're in small business and you're in hospitality, like, how has ICE not impacted you? So I don't know. Healthcare costs are going up. Like, how for employers? I'm struggling with the whole all-time highness of it. It's like, it doesn't seem like small business index would correlate with the stock market, right? In terms of like all-time highs. So I don't know. I just find it.
I don't know. I mean, small business owners may be on the upper part of the K and have a lot of investments. I don't know. I pulled it because it's an outlier. So
no, but that could be a way to look at it. That could definitely be a way to look at it. All right, let's keep it moving. Quickly, let's just Powell, came out with some comments, basically continuing to play the middle and not commit to doing significant rate cuts in the future.
Yeah, that's right. I mean, we have a lot of news between now and the next meeting. I think that it's going to be interesting. My guess is inflation is going to keep slowly creeping up, and yet we're going to need to have support on jobs. So he's going to have to balance that process, and we'll see. I mean, hopefully he will cut a little bit more, but I have no idea what he's going to do. He's certainly positioned it where he's giving himself space to cut again by saying it's modestly restrictive.
Yep, agree. All right, let's move on to VC deals. So the first one, Savaro Health secures $39 million for AI-powered virtual neurology and workflow augmentation. This round is led by Valtruis and Intermountain Ventures, so strong partners alongside on this one, and neurological care with AI and virtual solutions. So this seems to be in our AI VC review. I think one of the first AI deals really focusing on neurology. Is that right?
Yeah, I haven't seen. It's the first one I can remember seeing.
Yeah. So that's interesting to me. What else stuck out to you about this deal?
Yeah, I just thought it was a pretty good sized deal. I like the Valtruis crowd and Intermountain both, so strong backing, and I think we're going to see a lot more virtual, especially in specialty areas like this. I just think we're gonna need to have a consolidation in where you see specialists. So virtual, I was more focused on the virtual than the AI, really.
Yeah. Okay. Caregility raises $25 million in funding. So they are based in New Jersey. The round was led by Star Mountain Capital, and they are focused on connecting care for patients and clinicians.
Yeah, so this is another telehealth virtual. They use a bunch of AI, raise. It's, maybe crowded, but similar.
Thyme Care lands $97 million Series D backed by CVS Health, Humana, Morgan Health, and Memorial Hermann. So this is a company with some strong Nashville ties. I've met Robin Shaw, really, really bright guy. First Cressy was in on this deal pretty early, but they've got kind of a who's who of VCs around the table here. So we already said CVS Health Ventures, but Foresight Capital, A16Z, Concord Health, Town Hall Ventures, Alley Corp, First Cressy. I mean, that's really strong. And then they've also got Morgan Health, JP Morgan Chase's unit, Humana, Texas Oncology. So it's kind of like who's not in this deal, right?
Yeah. And it's, there's a theme of all these deals that this is also kind of a specialized virtual care, almost a way to find the right oncology specialist. They do other things besides cancer, but I think there's a heavy cancer theme to it too.
Yeah, for sure. And, I think that it's interesting. There have not been that many well-formed, well-funded new platforms on cancer. Like when people talk about Thyme Care, they sort of harken back to Flatiron Health, and lo and behold, Bobby Green and Robin Shaw both were at Flatiron Health, right? I mean, it's one of these spaces that it doesn't seem like everyone gets a key to try to take it on, but like if you've got the right team in it, you can attract a ton of capital from kind of all parties, right? Whether it's health systems, insurers, biggest VCs in the business, you can get a lot of capital if you can put the right team together.
Yeah, well, I mean, it's cancer and heart disease are sort of the two biggest markets with the most existing treatments and also a bunch of change, where for venture we need new treatments, new approaches, new things. And so I think there's just cancer oncology, unfortunately is a really big growth market.
Yep. Okay. PBM Capital Rx rebrands as Judi Health and banks a $400 million funding round.
Yeah, so this is another transparent PBM, which is, I think, really the next phase of PBMs. That the opaque, complex PBMs, I think, are sort of on the way out in general, although they have a big market share now. And so this was obviously a very large deal, $400 million, and the rebranding is good. I mean, I don't know if Judi is great or okay, but it's much better than whatever the
Capital RX.
Yeah, right.
Yeah, I think it is better than Capital RX. Around the table on this one, the round was led by Wellington Management and General Catalyst. Goldman Sachs was also at the table. The company's valuation was $3.25 billion prior to this round, twice as much as last year. So to me, this could not possibly be all based on the progress of the company. A lot of this has to be based on sort of the tailwinds around transparent PBMs.
Yeah, and when Wellington comes in, Wellington and Fidelity, when they start coming in, that's pre-IPO times.
Yeah.
They typically want to get in like the last round before an IPO.
Seven Starling raises $8 million to expand access to maternal mental health support. So this round was led by Rethink Impact, also included participation from Pear VC, our friends at Zeal Capital Partners, Magnify Ventures, Ulu Ventures, lots of folks that we know know well in on this one. And this is yet another, we just had one last week, but yet another women's behavioral health company focused on, perinatal mental health care.
Yeah. And so, I mean, we talked about this last week. It's a big space. There's a lot of need, and there's a lot of players. And, I think last week, I want to say Roku, that's not right, Rodu or something, raised $8.5 million. Seven Starling's raising $8 million. There's a lot of sort of medium capitalized competitors in the space.
Yeah. I mean, I think it's a space that's emerging, and so there's not. There's a belief that there's a market out there, but there's education, there's distribution, there's, working with payers. There's still a lot to be proven when you're sort of pioneering something it's patently obvious that it's needed, but it doesn't mean that the rails are all there. And so I think that's why there hasn't been, quite as much capital pouring into the space, not because it doesn't deserve as much capital, but there's still a lot of groundwork these founders are going to have to do to sort of prove that the market can, actually take care of these mothers, expecting mothers.
Definitely.
Okay. Until Labs raises $58 million to pioneer organ cryopreservation and medical hibernation. So this is a Series A. The round was led by Founders Fund, led with participation with Lux Capital and Field Ventures. So again, really strong VCs.
Yeah.
Founders Fund, getting into a sort of healthcare supply chain business seems interesting to me. So, it makes me think maybe somebody had some lived experience, one of the partners there that made them really interested in this space.
It's more of a tech play than healthcare, really. I mean, they have, and I have no idea if it works, but new cryopreservation techniques to be able to preserve entire organs for much longer periods of time. So right now we lose a lot of opportunity where you could do a transplant, heart transplant, lung transplant, but I think you have to do it between 4 or 5, maybe up to 12 hours. You have to do it pretty quickly. So teams, I know this, a couple people from here in Nashville, they'll fly to wherever the car accident was to get the organ and then bring it back to do the transplant. But you got to be rushing around to make it there. And if we could preserve it, you'd open up a lot more supply. I think that's why I think Lux is in. When I saw Lux, I thought maybe it's a tech innovation.
Yeah, well, it's a deep tech innovation. They're into heavy science. And look, I agree. I mean, I still think it makes me want to look more closely at Founders Fund, their portfolio, because maybe I'm not giving them enough credit for work they've done in and around healthcare before. And again, this is supply chain. It's not like direct healthcare, but it's just an interesting, fun name to see attached. We rarely see them when we're doing our VC reviews, right? So it just makes me interested. Amplify MD snacks $20 million to help hospitals scale virtual specialty care. So thought this one was interesting. It's a Series B. And they say they've got an AI-driven virtual specialty care platform and physician network. When I was reading through the article, and by the way, the round was led by Forerunner Ventures. Memorial Hermann is in the deal. F Prime is in the deal. Greylock is in the deal. So again, really strong partners. When I was reading it, it felt like this was largely a physician gap issue, right? So there's going to be shortages. More and more shortages are going to emerge for all the reasons we've been talking about forever on the show. And they've got this proprietary network that if you're part of the network, you can participate in, I guess, both putting your physicians on it, but also finding physicians to fill gaps, probably as close to real time as you might need. So that seems really important. I'm just curious about the AI driven virtual specialty care piece. I don't know that I fully get that. Like, is it actually helping to deliver care in some way, or is it that the AI technology is helping to do better matching and finding physicians and getting them, engaged in episodes of care at the right time?
Yeah, I don't know for sure. My reading was that it's much more using our physicians most effectively. So like maybe Memorial Hermann has a bunch of cancer physicians that have a little bit of capacity free. They could work with rural techs and health systems that need that specialty. I think the AI was added at the end because it helps market if you have AI something. I don't know how. I don't think they're really using like AI agents or anything like that in here. I didn't get
Yeah,
the sense of that.
it didn't feel like that was the core value proposition, but
Right.
just I'm always interested in making sure I understand,
Yeah.
what new AI is
I mean,
emerging.
at some
So we'll just
level,
have to kind
AI
of
is going to
watch them a
be in
little bit
everything.
closer.
But yeah,
Yes, exactly. Which is why it gets kind of annoying when you read it
yeah.
in a VC,
Right.
announcement. You're like,
Yeah.
how AI is it? Okay, moving on to policy. Trump issues warning based on unproven link between Tylenol and autism. We didn't talk about it at the beginning of the show, but big UN week.
Yeah.
We'll have to talk to Natalie and see how she enjoyed it. She was bouncing around New York this week.
Yeah.
But yeah, I mean, look, this Tylenol thing obviously blew up. And look, I mean, we're seeing we're seeing a group that has long held that there are a variety of different medications and vaccines that are not being properly regulated for their potential or some other stronger evidence that I've not seen role in producing autism. And I think it's just there's no question that the growing rate of autism in children in America is very, very serious and something that we need to be taking a real hard look at and making sure we understand. However, I do think that it's just getting to the point where we're struggling to know who the authority is anymore, right? I think we're struggling to know who the authority is. And I don't know how a lack of unity around who is an authority gives us the best chance as a nation to advance our collective healthcare system.
Yeah.
Go
We don't
ahead.
have a collective healthcare system anymore, I don't think. Like
No.
the thing that was surprising about this is not that Robert Kennedy is digging up every possible autism study and looking into it. There were two studies on Tylenol autism. I can't tell you if they were average or good or not good, but the former head of HHS had not chosen to act on them, and Robert Kennedy does. So that's not surprising to me. I think that's why he's been trying to work on this for a long time. What was surprising is that Trump, so they did this announcement at the White House, and Trump sort of went further, and instead of allowing
Yeah.
his cabinet member that he selected to do what he would do, presumably with some focus on finding the truth, instead of that, he went and made a bunch of other further claims, kind of getting out in front of his own cabinet members. To me, it's just sad. I mean, we have lost kind of credibility to the point where nothing is taken at face value because a lot of things are not what they appear. And that's just bad overall. I mean, whether Tylenol should be taken for if you're pregnant or not, to me isn't really the point. The point is that we can't rely. There's nothing to rely on anymore, which has negative consequences all over the place.
Yeah, I agree. I agree with you. I find it to be highly destabilizing. Nothing else to say. Trump's $100,000 H-1B visa fee sets off scramble across corporate America. I tried to stay on top of this because, obviously on face value, the hike in the fee is like, it's actually a bigger hike than any of the tariffs. Now it's isolated to an individual, but just if you take what the previous fee was and then look at where we're moving to, it's a radically huge jump. And then there was, okay, well, what does this actually mean? Like, is that true for all the existing ones? Is it only new ones? Are there particular countries from what, you know what I mean? So, again, totally intense rate of
I
change.
don't think we know.
And
I'm not sure we know those answers.
yeah, totally intense rate of change. And, this much instability doth not make a great foundation for a burgeoning economy. Meaning, like, why would you choose to do business in an environment that just look at this year, right? Between the tariff stuff and now this visa stuff, and there's been other things. It's just hard.
The whole point of the H-1B process is to pull in people that have skills and abilities that Americans don't have, or there are enough Americans that have it, because we need those skills and abilities. And putting up barriers to that to make a little money does not make sense to me. I don't see how that makes sense in any world. I used to have an investment
the number. I guess my point was just like the jump in the number is designed in a way that people are not just going to swallow that, right? You know it. So when you do it, it's even more than make a little money.
It's deterring applicants. That's what it's doing.
It's a deterrent. It's a deterrent.
And I used to have an investment in a nurse staffing business, and we don't have enough nurses. And we used several different plans. H-1B was one of them. And we weren't taking jobs from U.S. nurses. There aren't enough U.S. nurses. We were bringing in new talent to fill chronically open positions that cannot be filled. And so I do not think it makes sense. I'd rather see I don't care what the application fee is. The number of H-1B visas should be increased dramatically, but we're headed in the wrong direction, apparently. So.
Okay, so I found this story to be very interesting. This is... So
I pulled this story not knowing your understanding that you're following this particular doctor, but this is... I pulled it because there's a continuing trend of other groups kind of feeling like we have been talking about on this show, that there's a lack of scientific rigor or credible sources giving the public guidance and trying to step up to that. So last week, I think there were a couple of different state groups that got together, blue states in California and the West Coast and also New England. And then this was a story of, kind of a doctor creating a new platform to try to give people advice. But you know him from a long time ago.
Yeah, so Dr. Michael also home. I did not know him until COVID, and we were all in our homes, and I was listening to Joe Rogan podcast. I think at that time I was watching, because I don't think he had quite moved full time to Spotify yet, so I think I was like watching it on YouTube.
Yeah.
And he had this guy on, and this was the first person I heard say that COVID was airborne, and then it was not on little drops on railings, right?
Mm-hmm.
That it was airborne. And that, because you remember, like, we didn't know that in the beginning.
Yeah, right. At first it was surface. Yeah, surfaces.
It was surface, right? It was all on surfaces, right? And so I remember hearing this from him and being like, I believe that guy. And I think like this was, I feel like this guy was actually part of the beginning of Joe Rogan kind of becoming very distrustful of the information that was coming out of the U.S. government's, health agencies.
Yeah, because they weren't right. Right. Yeah.
Well, of course, once this guy became proven correct, I think Rogan just kind of really went down a rabbit hole after that, right? And because this was obviously way before vaccines, right?
Mm-hmm.
This was way before vaccines. This even predated masks because we weren't yet even allowing people to have masks at this point. This was very
you don't need a
early.
mask. If it's not airborne, you don't need a mask.
It's not. It wasn't airborne.
Right.
So anyway, long story short, I just found it interesting that he's the guy heading up this independent vaccine research and recommendation entity, sort of saying we need this information because probably unfairly, I anchored him in my own personal narrative, right? As maybe someone who was fully, because of where I first saw him, that, hey, this is a guy who, is totally against that particular party, right? But no, he's just an epidemiologist, and his mission is to get the information out. I would just urge people to pay attention to this agency he's starting. I think it's going to be really important to have independent agencies now. It just is.
Yeah.
It just is. And
with the science,
this guy is
hopefully the science takes them wherever the science takes them, and there'll be mistakes that scientists make. There'll be learnings that they find, but we need to trust that the people that we're listening to are really just pursuing the science as best they can and not thinking about all these other politically minded or cultural fights.
Yeah, so I plan on trying to see if they have a newsletter or something like that and signing up because actually I have deep respect for the guy. I just hadn't really heard from him since COVID. He's popped on a couple of shows here and there, but for me, he was the guy who informed me that COVID was airborne. So so I definitely think it's interesting. Okay, moving on. Regional nonprofit health insurers are falling behind competitors. This is moving into industry, talking about the payers. And this report basically says that there's a big difference between the nationals and the regionals and the not-for-profits. And the regionals and the not-for-profits, many of whom are blues, are really, really, struggling and losing operating margins at a pretty fast rate.
Yeah, and it's worrisome. I mean, we're going to have regional health systems and regional payers all underwater and in negative margin territory. There's a lot of people that have coverage through there, get their treatment at health systems, get insured, and then a lot of people that work at all these facilities and institutions. So the whole thing is scary, worrisome.
United Healthcare unveils direct-to-consumer tool to shop for health and wellness programs. So this is UHC leveraging their brand and their strong distribution specifically for employers, and they've built a health and wellness store basically. UHC has a strong ambition to continue to take their brand into a more kind of consumer. Direct-to-consumer place, and so this to me feels in line with their strategic ambitions, as far as I understand them.
Yeah, I mean, I think it is. Lilly really led with this. I think it's great that United is bringing out an offering. It's a little confusing where UHC consumer ends and where Optum begins, but over time, I think I'll probably figure that out as they roll it out. But good to see.
Yep. So this is an interesting one. Humana is ending commissions for some Medicare Advantage plans. And I think if Humana was almost any other payer where Medicare Advantage was a part of their business, we might read into that, oh, that means they are planning on downsizing their MA business, right? Because third-party marketers have, for a long time, been a really big part of growing Medicare Advantage roles for insurers. But now, given the pressures, given the focus on fraud, waste, and abuse, given the margin compression, and given the fact that Medicare Advantage is Humana's business, it's not just a portion of the business, it is the business. the ending of commission signals something much different, right? It signals a strategic shift and maybe a serious end for third-party marketers in terms of them having a viable business to drive more enrollment.
Yeah, that's right. And I don't know if I fully understand it. And Humana didn't really comment on the story. So Modern Healthcare broke the story. I think they, through investigative journalism or whatever, found it out. There's something between the PPO plans and the HMO plans. So 80% of the plans that they are not paying commissions on are PPO, where you need to pair a Part D drug plan with it. I can't totally recall. Emily was talking about a trend around that I can't fully recall, but there's something here to dig into more around the types of plans as well as how they go to market. But
Okay.
I'm not knowledgeable enough to know the details. But yeah, Humana is not going to, I mean, Medicare Advantage is a huge part of their business. So they're going to keep doing that, but not in the same way, not with these agents. The agents also caused a lot of trouble trying to sign up more health. I think they got paid more to sign up healthier, younger participants. And so it may be that Humana is building their own sales network so they can control those shenanigans and not have exposure. I don't know.
Since you brought up shenanigans, it could also be that Humana sees the writing on the wall and that there could be regulatory actions coming out around these third-party marketers.
Yeah. So they get in front of that.
And they may be getting out in front of it.
Yeah.
Yeah, they may be getting out in front of it. Okay, moving to health systems. Ascension returned to profitability in 2025. Huge turnaround story. Congratulations to everyone at Ascension. We know it was a lot of work for them, a lot of movement in their network, selling things off, engaging in joint ventures, overcoming a serious cyber attack. But they've returned to profitability. So, they were one of when we first started the podcast and we were talking about them and Common Spirit in particular, with really, really serious operating income, holes that they needed to dig out of. This is a big plus, right? I mean, especially knowing the headwinds that all health systems are going to face over the course of the next 5 years. At least they enter into this next window in a pretty strong position. So that's good.
Yeah, that's right. We need the big platforms like Ascension to be as strong as possible. Because the smaller groups are going to face headwinds, but it's great to see Ascension turn it around. It's well run, but to see them actually hit the numbers is great.
Yeah, and look, they had $1 billion loss last year, so
right. It's like almost a $2 billion swing.
Yeah, and when we first started covering it, they were $2 billion down.
Right.
So yeah, no, it's great news. Privia acquires Evolent's value-based primary care unit for $100 million. So Privia, definitely one of the best operated, value-based primary care businesses out there. We know several people in leadership over there, strong leadership team. I think this is great, that they're continuing to grow in a really smart way. And, 100 million is like not a crazy number. Like it's a good sized number, but it's not a crazy number. And that to me just smells more like, Privia being very, very sharp in their deal making here.
Yeah, that's right. I mean, I think they're a great operator. We'll see. Value-based care is challenging with all the different incentives needed, but Privia is running it really well. So we'll see.
Yeah. So just by the numbers, this deal adds more than 120,000 lives in the Medicare Shared Service Savings Program, various commercial programs, and Medicare Advantage. So it's a significant growth in lives for them. And just congratulations to Privia. Great leadership team over there. More than 46,000 Kaiser Permanente workers have authorized strikes as contract expirations loom. Again, this is another one of those stories that just seems to kind of be pretty cyclical, pop up, pretty regularly.
Every fall, I feel like it comes around. Yeah.
Yeah, and we see Kaiser at the as a big part of these, but they end up getting resolved, right? And we maybe it was just a few weeks ago we covered Kaiser having incredible operating income relative to almost all the other health systems out there. And so I'm certain that that news being public, didn't help their argument as their negotiations fell apart and led to this impending strike.
Yeah, I hope they resolve it. I mean, I don't know. I hope they resolve it. I don't. It's hard to say. I mean, I think the unions have learned how to negotiate much stronger than previously. So we'll see.
Yeah. I mean, I guess my view is Kaiser will end up paying something,
right,
and Kaiser will still operate well, and Kaiser will still deliver an operating margin. But like, you know what I mean? Like,
I mean, if you're going to operate in California, I mean, being in California and Oregon, it's a highly unionized medical workforce, and so you're going to have to navigate that.
Epic previews new interoperability features for patients, providers, and developers. I don't know if I could be less excited by an announcement than this one. I just feel like every time I see an Epic headline,
it's good that they're opening up the data, and they should have done it 10 years ago. But yeah, hopefully it will be true.
Yeah. If they're actually doing it. Nothing else to be said there. All right, moving into pharma. Pfizer to buy weight loss drug developer Metsera for up to $7.3 billion. So there's a pretty big deal. And also it's Pfizer stepping up their position in weight loss because they had to scrap an experimental weight loss pill. So clearly, their own pipeline wasn't working. So they've bought, probably one of the biggest independent ones, and their pipeline is really set to hit in 2028. It won't help Pfizer's operating, revenue issues for the next 3 years, but at least from the long game perspective, it gets them in the game that is currently winning, and it diversifies them away from the game that has been losing. Yeah,
that's right. It's a big move. I think a pretty healthy price, and at the same time, Pfizer needed something. They need to get in this game. So, yes.
Yeah, and I think it at least puts them more in line with Maha as well. So, hopefully, they can stop being the poster child for bad behavior in pharma and constantly being beat up. Roche to buy maker of fatty liver treatment 89 Bio for up to $3.5 billion. So this is, another player in the liver disease, obesity, kidney, space. I would say 3.5. That's a pretty big, big purchase as well. And again, we're just seeing all the pharma players realizing that the Novos and the Lillys of the world were ahead, and now they have to really catch up with their pipelines.
Yeah, I think Roche has a decent portfolio of assets, but you're right, it's definitely strengthening them.
And then also, Roche is launching late-stage trial of an experimental obesity drug in 2026. The phase 1 results showed that participants lost an average of 18.8% of their body weight over 24 weeks.
Yeah, so it's a little bit, it's an early phase 1, so we need to see more, but a little bit higher in results than either Lilly or Novo pills. But they're all in the teens. But yeah, it was a good result.
Yep. Okay. And then Novo says that Wegovy weight loss pill matches the shot as it eyes landmark approval. And so this is, Novo taking the Wegovy brand, taking it from a shot to a pill and looking to get approval and sort of get back on the right foot with, advancing their GLP-1 into a pill form.
Yeah, as we've talked about on the show before, the pill is going to be, I think, just a much bigger market that will take a pill, and it's a longer shelf life and harder to copy. So it's a lot of benefits of the pill, and so everyone's moving in that direction, and it's going to be interesting to watch. There's lots of competition.
Yeah, and we'll put one more story in the show notes for those who happen to be interested. We've been covering for months now sort of Novo's missteps and decline, change in leadership. It does appear that they may have hit the bottom of that downslide and could be on their way back up. So I don't know that there's much for us to discuss here, but an interesting story for those who may be interested in seeing how Novo might be turning it around. I think this Wall Street Journal story does a good job.
Yeah, I agree.
Okay, and then Eli Lilly to boost to build a $6.5 billion Texas facility to boost U.S. ingredient manufacturing. Feels like every 2 to 3 weeks there's an announcement about Lilly investing in manufacturing in the United States. It's a Midwestern brand, hailing from Indianapolis. It is, sort of the pride of Indianapolis. And I think they are a great corporate citizen in the cities that they're in. And the idea that they're continuing to expand the Lilly brand across America is, it feels both in line with their brand, but also just really, really smart based on, where the political winds are blowing. So I don't know. I'm struggling to see where we've seen Lilly make like a bad step against all the other pharma companies out there, right? It's like, I feel like Lilly and J&J really have kind of come through most of this pretty unscathed, continuing to perform well, continuing to have a unique position in the market, and then, making investments that are continuing to align them well with the current political leadership.
Yeah, no question. The only thing I have to add is this week it seems like a lot going to Texas. Texas getting a lot of new investment.
We're about to talk about some stuff on the AI side, right? Yeah. No. Good point.
Texas.
Good point there. Yeah, good point there. Okay. Quickly, we've got, I think, just one story from Web3, but it's a pretty big one. Vivek Ramaswamy's Strive is going to buy Semler Scientific in an all-stock deal, boosting the combined Bitcoin treasury above 10,900 BTC. So Strive is, I would say probably the latest, big Bitcoin holding company to come out on the market. You could probably tie them and David Briley's Nakamoto as sort of the two latest big ones to emerge with prescient leaders that have big brands and can aggregate more and more political and financial capital. But this is a big deal. I mean, it's worth over $1.2 billion when it's finalized, and I think Strive is really looking to make a strong financial platform that TradFi and maybe more traditional businesses will be able to work with, where Bitcoin is the underlying collateral, but there are many other different types of financial products that they offer. Vivek is a respected business person, successful entrepreneur. And when I look at the team he's building, I've got a friend, Ovik, who very, very connected politically, very smart guy. He's always been, big on Bitcoin, and he's actually leaving healthcare to go work over Strive. And so I think Strive's going to be, one of those firms that we need to keep a good eye on. Yeah,
no question. And Semler Scientific was one of the early Bitcoin treasury companies. Of course, Strategy with Mega Sailor's the first one, but they were in the first 5, I think, early on.
Yeah.
And I think we're going to start seeing some consolidation. I mean, this was a pretty big one for Strive to take down, but I think there's going to be consolidation in the Bitcoin treasury. There's just too many fairly little ones. Not so much Semler being little, but lots of little ones.
Agree. Okay, the VA plans to roll out Abridge and Knowtex AI tech across its health system. This is our first story on the AI rundown, and it's a pretty big deal for Abridge and Knowtex because this was a bake-off against other companies, and they were selected. So the VA is kind of a closed market. When you win, it can literally keep your business going. Just ask Cerner. And congrats to both Abridge and Knowtex. Really, really strong outcome.
Yeah, and like you said, a bake-off, they ran a full competition, and these were the 2 winners. So seemed like a good process, too.
Yep. Unity AI rolls out scheduling agents for outpatient clinics. This is covered by Fierce Healthcare. And I'm just happy we're covering it because A, it's Nashville-based, and B, it's our friend Edmund Jackson, who we probably should have on the show at some point. But Edmund's been a friend of Health Further from the days when Health Further was a conference. I think he was the speaker in our first or second year or something like that. And just a great guy. And it's been cool to see, for people who don't know, Edmund was the chief data scientist at HCA, their first ever chief data scientist, and recently launched his own AI company called Unity AI. And when he started, I think he had a much more broad view of the things that they would take on inside of a hospital. But now, he's really focused on outpatient clinics. He's really focused on scheduling, and I think he's found it's really, really important to not get caught up in just the broad AI hype, but like find a very specific program that you can lights out solve with AI, because there'll be plenty of money to be made there, or at least you can, build a really strong foundation to your business and then start to layer on either complementary business lines or more features selling into those same businesses to build out a platform. So I'm happy to see sort of the growth here with him. And they have not raised a lot of money. They've only raised $6.5 million so far.
Yeah, that's right. I think Edmund's a smart guy. I agree. He's been navigating this well. That we had 2 guest shows over the last month talking about this exact same sort of use case, using AI for phones, text messages, reaching out to patients, so that the humans don't have to do that kind of work. And this is the first one I've seen in outpatient clinic. So now broadening to not an inpatient health system, but more a clinic, physician group, or ambulatory surgery center. So pretty interesting. We should have Andrew on to talk about it.
Okay, now going to pure AI. Nvidia to invest up to $100 billion in OpenAI.
Yeah, this was the big investment story this week. They have, over the last couple of years, they've made $106 billion in net income, and they're investing $100 billion in OpenAI. And it is going to be in 10 different $10 billion tranches. And then I think OpenAI will turn around and use the money to buy Nvidia chips. And so it's an interesting, very connected investment.
Yeah, I mean, look, Nvidia, OpenAI, and Oracle, there's a lot of sort of circular investing, money going from one hand to another between these 3 companies. And so I think I was more impressed with the first announcement, but now that they've sort of come out in succession over the course of the last 3-4 weeks, maybe not as much. Maybe not as.
But I think it is going to keep, whether it's a bubble or it's real, doesn't matter. It's going to keep the energy going in AI for the next several years, I think.
Of course.
Go to this story. Thanks. Yeah.
Of course. So OpenAI unveils plans for seemingly limitless expansion of computing power. And Texas Prairie, the startup showcases ground zero of AI boom and its plans to shepherd $1 trillion in infrastructure spending.
Yeah. It's hard for me to envision $1 trillion in data center investment in Texas. It's just a lot of huge buildings, a lot of compute power. But it's sort of an all or nothing play. Like if OpenAI can get to AGI, and then AGI gets smarter and smarter, it doesn't matter what you spend, I guess. But $1 trillion is a lot of money.
Yeah, I mean, look, what I know you know, but you're just not saying, is the reason why these numbers are coming out is because they're talking about the replacement of vast numbers of humans from the economy, right?
Yeah.
And standardizing it through electricity and compute, right?
Right, and that's gonna cause significant social and political upheaval. And so how that ends, we don't know, which is why I didn't want to get too much into it. But yes, I mean, it's a $20 trillion economy, right? So if you replace 5% of the people with compute and electricity, you could have $1 trillion every year out into the future. The leaders of these big AI systems, not all of them, certainly Sam Altman is talking about replacing more than 5% of the people. So it could turn out that way. It also could turn out that it's slower and harder. But either way, there's a lot of money, a lot of energy, a lot of people. I think it's almost self-fulfilling when you put this much cash behind it.
Yep. AI agents arrive at Citi. So the financial firm said it would run a 5,000 person pilot to find out how helpful the new agentic technology is to staff in areas like research and client profiling. I think the notable thing here is Citi is a really big bank, and them talking about starting to really roll out AI agents probably signals many other banks are already doing the same, or will be making those announcements very soon as well. Citi probably struggled a little bit more than the bigger banks, your Goldmans and your JP Morgans, but they're in the middle of a turnaround, and I think obviously they're going to have to look at how they can cut expenses, and so it makes sense that they would be a little bit on the bleeding edge with this. But anything else notable that you found in the article?
Well, I mean, the title says correctly 5,000 people in a pilot. What I thought was really surprising is the pilot is 4 to 5 weeks long, and so they are gonna run this pilot in the fourth quarter, like right now, and then presumably learn from it and iterate. And so that was pretty surprising to me at the pace. Like Citi is a pretty big bank, running a pilot in 5 weeks and then learning from it and growing from there. Things are just moving very quickly. And so I wanted to note that, because if you don't read the whole article, like, I kind of assumed it might be a year-long pilot, or even,
Right.
in healthcare, we might even have a 2-year pilot, but a 5-week pilot's a different animal.
No, thank you for pointing that out. I missed that. Okay, down to our last two stories. Neon, the number 2 social app on the Apple App Store, pays users to record their phone calls and sells data to AI firms. We are cooked, Vic. We are so cooked.
It's the number 2 app, no, social app. I don't know if that's a subcategory, but the number 2 app implies a ton of people are downloading it.
Well, hold on. Social apps are the top apps.
Okay, so it means that huge numbers of people are using this on their phone to send all of their voice conversations to the big AI platforms. And the story does a good job sort of explaining, it's a very broad terms of agreement, right? So basically they can use your data to sell to AI companies in however form they want. It's only one side, so you opt in for your voice. Supposedly they don't take the other person you're talking to, which is important, I think. It's scary that people are opting in like this. I mean, I don't know how a couple of dollars makes sense to give your voice and all the stuff you're talking about, but apparently people are doing it.
K-shaped economy, man.
Yeah, maybe they don't have a choice.
K-shaped economy. And on that note of the K-shaped economy, PwC rolled out a report on healthcare last week, and they call it From Breaking Point to Breakthrough, the $1 trillion opportunity to reinvent healthcare. Now, Sam Altman would say $1 trillion, who cares? I'm spending that on infrastructure. But, to those of us in healthcare, $1 trillion is a big deal. And
they're talking about trillion annually. So, I mean,
I'm sure Sam Altman's talking about $1 trillion annually too.
Yeah.
Look, I like the positive slant, which is, hey, the healthcare system can't get any worse than it is right now, right? You know what I mean? And we're going to leverage innovation, and we're going to make a much better healthcare system for the future. And I'm all for that, right? I'm all for that. But, and I think this is a pretty big but, if you're on the inside of the healthcare industry, when you hear $1 trillion, right, that is usually associated with the future revenue losses that the industry is going to take as a result of HR1, the One Big Beautiful Bill, right? So I'm left to think that this is somehow implying that the $1 trillion that are going to be lost are somehow going to be refound, reinvested, redeveloped on this tech-enabled version of healthcare in the future. And, all the pictures here are, to me, are of people in really nice houses. You got a picture here of a guy with a drone come in. We have like one of those mirror, workout systems. So all the imagery, really harkens to, a world that there's the woman there with the mirror. These are all people who are pretty well to do. Like if we were to look at the K-shaped economy, these are people who would be on the top part of the K. At least that's what it looks like to me. right? And the bottom part of the K, I don't necessarily think it's addressed in this report. Now, I think we've come to a similar conclusion from an investment thesis perspective. You and I talked about it this week, that yes, like the sector is going to need to adapt, and it's going to be, companies of the future, and we're going to be leveraging technology and all these different types of things. These are very, very important. But they end the story talking about they end this paper or this report talking about the innovation divide, right? And they admit even the most advanced transformation won't automatically close healthcare gaps. 58% of Americans believe access to quality healthcare depends on income or societal status. And then they kind of say, as a result, 3 consumer profiles will emerge. Empowered consumers, we talk about those all the time. You and I are those. Mainstream America, and then the underserved consumers. And what they say about the underserved consumers at the end is that digitally disconnected, they continue to receive episodic, crisis-driven care, resulting in worsening outcomes and higher costs. And so there's not really, when they talk about building in equity from the start, I'm just kind of like, but who is going to pay for this new technology-driven world for people on the bottom part of the K? Like who's going to pay for that?
Right. I mean, they do not answer that question. And then where I thought you were going to go, like right below it, like they end the whole thing with this picture of a amputee who's working on something on the floor, which is kind of a weird image. But this headline is how the future could play out: lead, follow, or fall behind. And I think that's fairly insulting and kind of tone deaf to the underserved consumers. Right? Like they're going to fall behind.
Yeah.
And it's not because they don't want to have this future for themselves. They just have no ability to access it.
No.
And so, I mean, I think PwC is doing a great job sort of painting how healthcare could evolve for the wealthier, maybe half, that might be generous, half of the country, it might be less than half. But we're going to have to figure out, I mean, the thing about healthcare that I think is important, part of the reason that you and I are in it is we have to provide health for all of our citizens in some form or fashion. Now, of course, it's not quite as good as if you get concierge care or whatever, but there needs to be some basic level of health for all Americans, for all citizens, for all people. I'd say for all humans.
And we don't have nationalized healthcare, right? I mean,
right.
We have CMS, right? And we have HHS, but that's not the same thing as nationalized healthcare, right? And so we don't have that. We don't have that baseline of care for every single citizen. And we're painting a future of the healthcare industry that is for the wealthy.
Yeah, and that's fine. I mean, that might sell a lot of consulting projects for PwC, but there needs to be solutions where we spread this abundance, spread the wealth, spread the capabilities to everybody, or at least to a broader set of people.
Yeah, and I think I would just say in advance, like for any of our listeners who are techno optimists and maybe like stop thinking in limited ways, think abundantly, blah blah blah. Vic and I, we take in as much, if not more, of this content than you do. Nobody's got a good answer for how we're going to take care of the poor people, right? They've got shallow theories at best, but no working plan. Not even actually close to a good working plan for how we're going to do it. Meanwhile, they are accelerating AI at unbelievable rates. That's only going to cause more unemployment, right? I think we just got to sort of say this on a regular basis. Those are the things that are true. Now, then there are also people saying we don't know what the future holds. That I can admit to. We don't know what the future holds, but we know we're running towards a future that is going to bring near zero cost intelligence to market. It will radically replace human professions. We do not have a good answer for what we will do for those humans who are replaced. So you can presume if we don't have a good answer, there is at least a reasonable chance that they will go down in their socioeconomic status, right? And their ability to take care of themselves. And so it appears we are increasing the number of people who we need to be thinking about how we're going to take care of, and we have no plan on how we're going to take care of them. But we're talking about like drones and, fun exercise mirrors, which by the way, like you and I can afford.
Yeah, which is fine.
Right? So,
like I have no problem with that, but we need to come up with a plan that's coherent for the rest of the people. And I wasn't going to talk about it, but I feel so strongly that I wrote a book about this because I think it's a really important thing to begin thinking about. How do we take care of the population? How do we take care of the humans that are going to invent the next internet, the next thing? They're 10 years old today, but we need to take care of them. And that is probably even broader than the US. But at least in the US, we need a solution. And it's a complicated story that it took me 5 years to put together a potential concept. And there's lots of exciting aspects, but you have to think through the rest of the population too. Or I think you don't get the exciting stuff because there's a revolution or people start throwing, Molotov cocktails around because they're just frustrated and have no way out.
Yeah, let me just say this, and I still need to like digest your book.
I wasn't. We didn't get into the book, but we need a solution.
No. Listen, I actually think we should do a show with you talking about the book.
Yeah.
I mean, because I want to dig into it more with you. And I also want to say I've never been one of these like super gung ho America needs national healthcare system, single payer. Like I've never been that way because I've always sort of looked at the trade-offs, right, with other countries, and like you don't always get quick access to care. Like there's a million problems, right, with nationalized healthcare. And I've always thought, hey, we need to sort of look at, there are models in the world that work with, have very high outcomes at very low cost. They don't have, nationalized healthcare, right? So, and have a system more like what we have. But based on where we're headed, I mean, the countries that have nationalized healthcare in place right now are in a far, far better place than America is. Far better place. Because we're at a cliff with our general population, with a weakening healthcare system, right? It's weakening. It's going to get less capital. We're going to have less providers in it. It's fraying.
Yeah, and I mean, you said it well. I think we study this very, in depth, and the universal basic income and people that say the tax base will increase and will then have subsidized it, they're wrong. I mean, those plans, I agree with your terminology, they're shallow. Like, not that they can't work, but the current ones that are being thrown around are not right. They're too shallow and they don't work.
Yeah, they're either not politically viable or they don't really take into account the truth of human sociology. Like they're just not real. They're not real yet. We don't have anything that's real yet, right? So in the meantime, we are headed to a pretty dangerous situation.
Yes.
That's the reality. And oh, by the way, like you're not going to have that many investors or innovators going into this space because they're not viable.
That's why PwC is not writing about it. I mean, there's no clients. There's no way
not
to
a market.
Go to consulting business. Right. Exactly.
Right. Yeah. They're not viable.
Yeah.
To invest in.
Yeah, that's right. Which is scary or sad. I don't know.
Yeah.
So they did a
I've been
good
a
job.
little fired up
but
about this point lately.
Yeah, yeah. Well, I mean, I think all we can do is cover where we are in healthcare right now, and then maybe we can invest in some new innovations that are going to make a difference.
Yeah, well, let's make sure in the future we book a show.
Yeah, we
one of
should
our
do a
guest
show.
shows. You'll be the guest,
I can be the
and
guest. It'll be fun.
yeah, and we'll focus on Elevate Health.
Yeah.
By the way, when is the book dropping?
October 6th. So we should do it after it
It's
comes
around the
out.
corner.
Yeah, it's
Yeah, it's around the corner.
Week or two away. Yeah.
Awesome, man. All right, man. Well, look, I will see you next week at Sessions.
Okay, and then we'll be in the studio.
And yeah, exactly. Then we'll be in the studio next Thursday. Thanks for everything.
Yeah. All right. Bye. Thanks.